You know that feeling, right? When you're trying to keep up, stay informed, and it just feels like this constant wave of information.
Information overload.
Exactly. It's exhausting, especially when you just want the basics, the essentials. Well, that's what we try to do here.
Cut through the noise a bit.
Yeah. And today we're diving into something with a lot of buzz AI in healthcare.
It's everywhere now, isn't it?
It really is. But we want to get past the sci-fi stuff and look at how artificial intelligence is actually practically starting to appear in medicine.
The real-world applications.
Right. We've gone through quite a bit of material, looked at the research to kind of pull out the core things you need to know.
The fundamentals.
Our mission, really, for this deep dive is simple. Just give you a clear, accessible picture of AI in healthcare so you can get what's important without drowning in jargon.
Sounds good.
Okay, let's unpack this. So at the most basic level, what are we actually talking about? AI in healthcare.
Okay, yeah, good starting point. You can think of AI in this context as, well, maybe like a highly intelligent assistant.
An assistant.
Yeah, one that's constantly learning, getting smarter all the time. And this field, it's not just growing, it's really evolving incredibly fast.
Right.
And it genuinely has the potential to really change how healthcare works for all of us.
Okay.
At its core, AI in healthcare uses computer systems. They're designed to learn from absolutely vast amounts of data.
Like what kind of data?
Oh, things like medical images, x-rays, scans, patient records, research papers, lab results. Huge amounts.
Okay.
And the AI learns to spot patterns in all that data. Patterns that might be too complex or maybe just too subtle for even a really skilled doctor to catch easily. And then using those patterns, these systems can actually make some surprisingly accurate predictions.
Predictions about what? Like diagnoses?
Yeah, diagnoses, how well a treatment might work, even predicting potential health risks down the line.
So it's kind of like a superpowered data analyst then, sifting through mountains of info, finding connections that we as humans might just miss.
Exactly. That's a great way to put it. And what's really crucial here, the fundamental goal isn't about replacing doctors or nurses.
Right. I hear that a lot.
Yeah, it's important. The focus is really on augmenting their skills. Making them better.
Augmenting. Okay.
Think of AI as this incredibly powerful tool. It can empower healthcare professionals, help them deliver care that's, well, not just more efficient, but also more effective, and maybe most importantly, more personalized to each patient's specific needs.
Okay, that makes sense. More personalized care. But why now? Why do we need this intelligent assistant in healthcare right at this moment? What are the sort of real-world problems it's trying to solve?
That's a really key question. Look, modern healthcare systems, they're facing some pretty big challenges.
Like what?
Well, for one, doctors, nurses, they're often just swamped with information they need to process constantly. Think about it, reviewing patient histories, looking at new lab results every day, trying to keep up with the latest medical research.
That's a lot.
It's a huge amount. And then add on top of that the heavy administrative burden, paperwork, documentation. It takes up so much time.
Time they could be spending with patients.
Exactly.
Yeah.
Valuable time. And let's be honest, the healthcare system itself can be incredibly complex, right? It's often difficult to navigate, both for patients and even for the providers within it.
Yeah, definitely.
So AI offers a way to help with all that. It can streamline a lot of these processes, augment those human capabilities we talked about. And, the ultimate goal is improving patient outcomes and making the whole system run more efficiently.
Okay, so it's helping manage the complexity of the information overload. Can you give us some, concrete examples? How is AI actually being used right now?
Absolutely. Yeah, we're already seeing it pop up in several key areas. One really important one is in what they call clinical decision support systems.
Clinical decision support.
Right. Think of these as AI tools that analyze a patient's data symptoms, history, test results, all that, and then they provide the doctor with insights, maybe recommendations, to help them make the best possible decisions about diagnosis or treatment.
So it's like having a super consultant available.
Kind of, yeah. Helping them weigh the options based on evidence. Then there's the whole field of personalized medicine, which is incredibly exciting.
Tailoring treatments.
Exactly. AI can help tailor treatments very specifically to an individual based on their unique biology. That can even include looking at their genetic profile to predict how they might respond to certain drugs.
Wow.
And another really significant area is disease screening.
Catching things early.
Yes. AI algorithms can be trained to look at medical images, like mammograms or retinal scans or other data, and help spot potential early signs of diseases like cancer or diabetic retinopathy, sometimes even before a person has any symptoms.
That screening part sounds like it could have a massive impact, catching diseases earlier. How does that play into broader public health stuff?
Oh, absolutely.
Yeah.
This really highlights how far AI's reach can go. It's becoming a really valuable tool for public health on a larger scale.
How so?
Well, particularly in areas like tracking communicable diseases. For instance, AI can help with something called syndromic surveillance.
Syndromic surveillance. What's that?
Basically, it means using AI to quickly analyze reported symptoms across a population, maybe from emergency room visits or pharmacy sales, looking for unusual patterns.
Patterns that might signal an outbreak.
Exactly. It could indicate a common exposure or the very beginning of an outbreak, even before we have lab confirmation of what the disease actually is.
So getting ahead of it.
Right. And maybe even more powerful is AI's role in epidemic forecasting and early detection.
Predicting outbreaks.
Yeah. By constantly analyzing huge amounts of real-time data, mining different records intelligently, AI can help predict how diseases might spread. This gives public health officials a crucial early warning.
So they can be proactive, not just reactive.
Precisely. It allows for a much faster, more targeted response instead of just chasing a crisis after it's already started.
That's fascinating. It's not just tracking, it's predicting. We actually talked about medical research in another deep dive recently. How does AI fit into research and clinical trials?
Yeah, that connects really well. If you think about how medical knowledge advances, AI adds huge value there. Electronic health records, or EHRs, when used responsibly, of course, with privacy safeguards.
Of course.
They contain a gold mine of information. AI can analyze this anonymized data to help find patients who might be good candidates for specific clinical trials.
Matching patients to trials.
Yes. This could significantly cut down the burden on patients trying to find trials themselves. They might not even know what they're eligible for.
Right.
AI can scan through anonymized records, identify people who meet the criteria, and potentially dramatically speed up the whole enrollment process.
And that means getting new treatments out faster.
Ultimately, yes. Getting potentially life-saving treatments to the people who need them much more quickly.
That really could be a game changer. Okay, shifting gears just a bit. Are there ways AI is directly improving the patient experience, like day-to-day interactions beyond just the treatment itself?
Absolutely.
Yeah.
Think about when someone leaves the hospital.
Okay, discharge.
Right.
Okay.
They often get a stack of papers, discharge summaries, instructions, and honestly, it can be really dense, full of medical jargon that's hard to understand.
Yeah, definitely confusing sometimes.
Well, here's where it gets really interesting. We're seeing the rise of tools using large language models.
LLMs.
LLMs, like ChatGPT and those kinds of things. Similar technology, yeah. These are very sophisticated AI systems, really good at understanding and generating human-like text.
Okay.
So these LLM tools can now help generate those discharge summaries by pulling the key info from the patient's EHR.
Okay, summarizing it.
But more than that, they can then rephrase it, turn it into clear, simple, personalized instructions, written in plain language so patients actually understand their next steps, how to manage their health at home.
Ah, bridging that communication gap.
Exactly. Making complex medical info much more accessible.
That's a brilliant example, really practical. Now, what about the healthcare professionals themselves? We hear so much about burnout in healthcare. Can AI help there?
That's a critical point. And yes, AI has huge potential to help ease some of that administrative load that really contributes to burnout.
Oh.
Well, those same LLMs we just mentioned, they can also help with writing clinical notes, which takes up a ton of time.
Right, documentation.
Yeah. They can help summarize patient info, they can transcribe what a doctor dictates, maybe even suggest possible diagnoses or treatments based on the data entered.
So less time typing, more time with patients.
That's the idea, freeing up clinicians. We're also seeing more AI-powered voice-to-text software. Doctors can just dictate their notes quickly and accurately during or right after seeing a patient.
Dictation tools.
Right, and the time saved on documentation. It can be substantial. It lets doctors and nurses refocus on actual patient care, which is, what they want to be doing.
Less paperwork, more care.
Yeah.
Sounds like a win-win. What about the less visible side, like running the hospital itself, the operations?
Yeah, what's fascinating is how AI can optimize a lot of the crucial behind-the-scenes stuff, too.
Like logistics.
Exactly. Things like resource management. AI can analyze past data, current trends, and help predict staffing needs.
So making sure there are enough nurses on a shift.
Precisely. Having the right staff in the right place at the right time, it can also help optimize patient flow through the hospital.
Patient flow, like reducing wait times?
Yeah, reducing ER wait times, streamlining admissions, discharges. making the whole patient journey smoother.
Okay.
And looking even further, there's potential in things like insurance claims processing, using AI to maybe speed up approvals for treatments, possibly even help reduce fraud.
Wow. It really does seem like the reach of AI here is incredibly broad. It touches almost everything.
It truly does. It's even extending into things like post-discharge care, monitoring patients after they leave the hospital.
How does that work?
Well, AI can analyze data from wearable devices, maybe remote monitors in the patient's home.
Like fitness trackers or more specialized devices.
Could be either or both. The AI looks for subtle changes, potential problems, and can trigger alerts.
So catching issues before they become serious crisis.
Is the goal. Early intervention. And don't forget, medical education.
Training new doctors and nurses.
Yeah. AI is being used to create more personalized, interactive learning experiences for the next generation of healthcare professionals, helping them learn more effectively.
Okay, so when you pull all these different applications together, the main message really seems to be about assisting healthcare pros, right? Making things better, supporting them, not taking over.
Exactly. And that's such a crucial point to emphasize for everyone listening. AI in healthcare is not meant to replace human judgment.
The empathy, the critical thinking.
Precisely. Those are irreplaceable. Instead, think of AI as this powerful tool. It's like a vigilant guardian watching for issues. It's like a personalized mentor offering insights from data. It's like a safety net, catching potential problems early.
Guardian, mentor, safety net. I like that.
Yeah. It all works together to augment the amazing skills healthcare professionals already have. The ultimate goal at the end of the day is to empower them, strengthen the whole system, and get better outcomes for all of us.
That makes a lot of sense. Now, obviously, the potential sounds huge, but we know with any new tech, there are challenges, right? Like data quality, ethics, privacy.
Absolutely right. Those are huge considerations and need careful handling. But, as we move forward, the potential benefits are just enormous. If we develop and implement AI thoughtfully, carefully. Responsibly, yes. Building on things like EHRs and secure data sharing, it really points towards a future that could be much safer, more efficient, and just more responsive to everyone's healthcare needs. Ultimately, it's about using these smart tools to cut through the complexity of medicine and just focus on that main goal: better health for patients.
This has been incredibly helpful, a really clear introduction to AI and healthcare. Thank you for walking us through it all.
My pleasure.
It definitely makes it feel less like some abstract futuristic thing and more like, it's like a powerful helping hand that's already starting to make a difference today.
It's certainly encouraging to see how technology can potentially improve health and well-being.
Yeah. Okay, so that brings us to the end of this deep dive. Now, for you listening, here's something to think about. Based on everything we've talked about, what specific part of healthcare do you think AI will impact the most in the next, say, 5 years? And maybe, what are your biggest hopes or perhaps your biggest questions or concerns about AI playing a bigger role in medicine? Definitely something to mull over. Until our next dip dive.